morning, sir. I am Kristine Gumboc from Medical Colleges of Northern Philippines. Before we start, sir, can you please state your name and your birthday?
My name is James Esther Dunn. May 5, 2004 is my birthday month.
Okay. So, how would you like me to address you po?
You can call me James.
Okay, Sir James, today I will be going to assess your thorax and lungs, wherein I am going to touch a certain part of your body. Is that okay with you, sir?
Yes, ma'am.
Okay, next we are going to perform hand hygiene. And in my case, I'm done closing the door and the curtain for the patient's privacy. And next, we are going to help the patient address if needed and provide the patient gown. Okay, sir, can you please put on this box? And I'm done assisting him to a sitting position and expose only his posterior thorax. And then next, we are going to inspect the posterior thorax, examine the skin and bones of the spine, shoulder blades, and back as well, asymmetry of expansion, and the use of accessory muscles during respirations. So, please can you, sir, can you please inhale, exhale po, slowly lang po. Okay. Next, I am going to assess the anteroposterior and lateral diameters of the thorax. Can you please, sir, can you please sit erect po for me to assess it properly? So, in my case, the diameter of the patient is 1:2. And then next, I am going to palpate over the spine and posterior thorax. With the use of my dorsal surface of my hand, I am going to palpate for his temperature. And then with the use of my palmar surface of my head, I am going to palpate for the tenderness, muscle development, and masses, and as well for his tactile firmitude. Sir, whenever I move my head, can you say this 99?
99.
Okay, next.
99.
Okay, next.
99.
Okay.
99.
Okay. Then next, I am going to assess the thoracic expansion by standing behind the patient. And then I'm going to place both thumbs on either side of the patient's spine at the level of T9 or T10. By doing this procedure, we are going to ask the patient to take a deep breath. Can you please take a deep breath, sir? Okay. For the next procedure, we are going to percuss over the posterior and lateral lung fields for tone using a zigzag pattern, starting above the scapulae to the bases of the lung. Okay, can you please take a deep breath, sir? Okay. Next, I am going to auscultate the lungs across and down the posterior thorax to the bases of the lungs as the patient breathes slowly and deeply through the mouth. So, can you please breathe po, sir, using your mouth po? Breathe, sir. Breathe, sir. So, can you please take a deep breath po using your mouth? Okay. So, we're done with the posterior thorax. For the next procedure, I am going to examine the anterior thorax. So, in my case, I'm done assisting the patient in a sitting position, and also I'm done rearranging his gown, only exposing the anterior chest or the thorax rather. And then next, I am going to inspect the skin, bones, and muscle, as well as symmetry of lung expansion and the use of accessory muscle. Sir, can you please take a deep breath po? Slowly, sir. Okay. Next, I am going to palpate the anterior thorax for the tenderness or any masses or lumps, and then as well for his tactile firmness. Sir, whenever I move my hand, can you say please? Can you please say 99?
99,
Okay.
99,
Okay.
99,
Okay.
99.
Okay. For the next procedure, I am going to percuss over the anterior thorax. And then next, I'm going to auscultate the lungs through the anterior thorax and ask the patient to breathe slowly and deeply through the mouth. Sir, while ausculting your anterior thorax, sir, can you please take a deep breath po using your mouth? Okay. Okay. The next procedure, I am going to inspect the breast and axillae. Sir, can you do this po? How about this, sir? Can you raise your both hands po, sir? Okay, next done. For the next procedure, let's assume that I'm done palpating the patient's axillae. And then next, I'm going to assist the patient in replacing the gown and perform hand hygiene.